Hi, today we will talk about vaginal dryness during relations. I am Dr. Seema Sharma, founder director of Srishti Femcare, and today, by means of this video, I am going to be answering a very common question a lot of women and men also ask me, that while having physical relations, they feel dry and they cannot enjoy the physical relations to the extent that they were probably, when they just got married, or with age now it has come down. So first, before I answer this question, let us understand what causes wetness of a female intimate part, that is the vagina. So there is a lubricating fluid which our body secretes, and it can start with sexual thoughts, the fantasies, a look at a pornographic movie, the desire to be intimate. It is very important that a woman is aroused enough, because in a woman, brain sensations are extremely important to start lubrication, because a lot of sexual fantasies and all, instead of totally being physical, they are a lot mental in case of a woman. So that is a very big difference between a man and a woman, that a woman needs a subjective arousal before actually anybody can touch her physically. So, it is, put it simply, it is important to get your partner into a mood to have sex. So when there is a desire, there is then brain sends impulses to the vaginal glands, and these glands would then produce lubrication. So this happens generally without, when there is no problem. uh, so it is important, one, you have to create an environment to feel that woman is wanted physically, so she can have a better lubrication. Also, if there in a previous sexual encounter there has been some kind of an unfortunate incident you did not enjoy, there was pain, so those sensations are carried over for the present episode also. So by means of this video, I want to tell couples that it is important that you reduce sexually frustrating encounters. It's okay, once in a while every couple has this, but if there is a repeated pain, there is a repeated issue, please check with your gynecologist or your physician or whomsoever you are very comfortable with, and let it get sorted out before you go on and on, where it before that it gets medically, it gets mentally implanted in you that no, you don't want sex. So one is that. Second is, generally when a person is under, a woman especially, she is under medications. Common medications are weight loss medications, there's thyroid medications, the diabetes medications, contraceptive pills, anticonvulsants, so on and so forth, antidepressants. All these medications would bring down desire, or libido as we call it commonly, in a woman, and she would be very dry. So it is important to find out, you need to talk to your doctor as to find out what exactly is happening, and why earlier she was normal and now she is not normal. So most important factor that I have seen in my practice, wherein there is no medical factor but a woman still is dry, is because of fear of pain, and she is inhibited, she is withdrawn, and she cannot be relaxed, and she has a poor body image, and that is the reason why she is very dry. Now, what does a couple do if either of the partner feels very dry, cannot enjoy physical relations? So one thing is, you can use lubricants which are commonly available. You don't need a prescription for that. Over the counter lubricants are available. I insist that they should be water based lubricants, so that there is a, and they are better to be used with a condom. You can apply it as many times on your external body parts, so that there is no friction of physical relations, and there is no pain, and things are easier. So you're mimicking the natural fluid which is normally secreted, but it is less in your case. Second thing that one can do is, a woman especially, I keep insisting that you must do your Kegels exercises. So when you do your Kegels exercises, these are, people who don't know, these are the exercises that are important to keep urinary control, bowel control, and they keep your vaginal muscles in good tone. Also, when muscles are in good tone, your lower body parts are well exercised, they will produce better lubrication, and also you will have better sensations while having physical relations. So second thing is, keep doing your Kegels exercises. And if you feel that you've been doing Kegels exercises and they are not effective, now pelvic physiotherapy is available with few leading doctors, and it is also available at our clinic. Those sessions are extremely useful to improve the pelvic muscle tone, and also they can correct dryness to a large extent. Then the third thing is, if you are already, say, above a certain age, or your periods have stopped, you've become menopausal, body naturally will become little drier. Your skin gets dry, your intimate parts gets dry, secretions, generally your hair, are you're losing your hair, secretions from all over the body generally tend to reduce with age. So when they are reducing, you will feel that your private parts are also very dry, and you no longer enjoy relations as you could earlier. In that situation, some hormonal creams can be prescribed, but this is a doctor's prerogative. You should not buy those creams over the counter, because these are hormonal preparations. We have estrogen preparations, we have testosterone preparations. So all those have to be taken under the guidance of a doctor. So these are a few things that one can do. You can prolong your foreplay before you actually insert into a woman, and vice versa, so that the physical friction and the physical pain can be minimized if a person is suffering from severe dryness of the intimate parts. So these are all my medical tips that to a couple who is actually suffering. But also, if anything lingers on for more than 3 to 4 months, it is time to go for a checkup, because there could be a lot of sinister underlying issues that need to be sorted out. So well, that's about it, and that's all for today's video. Thank you so much.